Introduction. Welcome, medical students, to today's lecture on the fascinating topic of neurology, specifically, the mechanisms and management of migraine disorders. Migraine is a common neurological condition characterized by recurrent headaches often accompanied by sensory disturbances and other symptoms. In this comprehensive lecture, we will delve into 12 key topics related to migraine, exploring everything from its underlying mechanisms to its management and impact on quality of life. So, let us begin our journey into the fascinating world of migraine. Migraine aura refers to visual disturbances or neurological symptoms that may precede or accompany a migraine attack. It is believed to be caused by cortical spreading depression, a wave of neuronal hyperactivity followed by suppression. This phenomenon leads to changes in the blood flow and neurotransmitter imbalances, resulting in aura symptoms such as visual disturbances, tingling, and speech difficulties. Understanding the mechanisms underlying migraine aura can provide insights into the pathophysiology of migraine and guide therapeutic interventions. Familial hemiplegic migraine, FHM, is a rare subtype of migraine with aura that runs in families. It is characterized by severe, disabling attacks of headache accompanied by motor weakness on one side of the body. Mutations in specific genes, such as CACNA1A, ATP1A2, and SCN1A, have been identified in FHM patients, leading to neuronal hyperexcitability and altered ion channel function. The study of FHM has provided crucial insights into the genetic basis of migraine and shed light on the intricate interplay between ion channels and migraine pathophysiology. Many women experience migraines that are closely linked to their menstrual cycle. Fluctuations in sex hormones, particularly estrogen, have been implicated in the pathogenesis of menstrual migraine. Estrogen withdrawal, which occurs just before menstruation, is thought to trigger migraines in susceptible individuals. Understanding the role of sex hormones in menstrual migraine is vital for tailoring treatment strategies and providing effective relief to women who experience hormonal migraines. Migraine triggers are individual-specific factors that can precipitate a migraine attack. Common triggers include dietary factors, for example, chocolate, caffeine, hormonal fluctuations, stress, sleep disturbances, and environmental factors, for example, strong odors, bright lights. However, the relationship between triggers and migraine onset is complex, and triggers can vary widely among individuals. Unraveling the trigger puzzle is crucial for empowering patients to identify and avoid their personal triggers, reducing the frequency and severity of migraine attacks. Medication overuse headache, MOH, is a common yet under-recognized complication of migraine treatment. It occurs when acute migraine medications, such as triptans or analgesics, are used excessively and frequently, leading to a rebound headache. MO is a challenging condition to manage, often requiring multidisciplinary approaches involving medication withdrawal, preventive strategies, and patient education. Understanding the mechanisms and management of MO is essential to providing effective care for patients with chronic migraine. Some migraine patients experience chronic daily headaches that can significantly impact their quality of life. This transformation from episodic migraine to chronic daily headache or refractory migraine is poorly understood but is thought to involve complex neurobiological changes. Chronic migraine is often associated with medication overuse, comorbid psychiatric conditions, and central sensitization. Identifying the underlying mechanisms and implementing appropriate management strategies is crucial for improving outcomes in patients with refractory migraine. Migraine is not merely a headache disorder, it is a complex neurological condition with a myriad of associated symptoms. These symptoms can include nausea, vomiting, photophobia, phonophobia, cognitive impairment, and mood disturbances. The understanding of migraine has evolved to encompass not just pain but the intricate interplay between various neural systems affected during an attack. This broadened perspective is paramount in providing holistic, patient-centered care for individuals with migraine. Migraine can have a profound impact on patients' daily functioning and overall quality of life. The disability caused by migraines often extends beyond the duration of attacks, affecting work productivity, social relationships, and emotional well-being. Assessing and addressing the impact of migraines on disability and quality of life is critical in tailoring comprehensive treatment plans and improving outcomes for patients. Pregnancy poses unique challenges in the management of migraines due to concerns over medication safety for the mother and developing fetus. Hormonal changes during pregnancy can have varying effects on migraines, with some women experiencing improvement while others may have worsening symptoms. Striking a balance between providing effective relief and minimizing potential risks requires a thorough understanding of the available treatment options and considering the individual patient's needs and preferences. Triptans have long been the gold standard acute treatment for migraines. However, recent advances in migraine therapeutics have led to the development of novel targeted therapies, such as anti-calcitonin gene-related peptide, CGRP, monoclonal antibodies. These medications offer a promising alternative for patients who are refractory to or intolerant of conventional treatments. Understanding the mechanisms of action and clinical applications of these emerging therapies is vital for optimizing migraine management. Pediatric migraine poses distinct diagnostic and management challenges compared to adult migraine. The clinical presentation and associated symptoms in children may differ, making accurate diagnosis challenging. Additionally, considerations related to medication safety, lifestyle modifications, and educational accommodations must be addressed when managing pediatric migraine. Knowledge of pediatric-specific migraine characteristics and evidence-based management approaches is essential for providing optimal care to this vulnerable population. Our understanding of migraine pathophysiology continues to evolve, with new insights emerging from genetic studies, neuroimaging techniques, and experimental models. These advances have shed light on the role of cortical spreading depression, trigeminovascular system activation, and the involvement of various neurotransmitters in migraine pathogenesis. Staying abreast of these novel insights is crucial for informing the development of innovative therapies and improving outcomes for individuals affected by migraine. To conclude, migraines are complex neurological disorders that require a comprehensive understanding for effective management. Our journey through these 12 topics has provided a glimpse into the intricate mechanisms underlying migraine, the impact it has on patients' lives, and the diverse management strategies employed. As future healthcare providers, it is essential to continue expanding our knowledge in this field, enabling us to provide the best possible care and support for patients with migraines.